Chapter 18, Nutrition During the Adult Years, Screencast 3. Now, one thing that I want to point out, this particular screencast is supporting the previous screencast. And remember the table that was covering the last few slides in the previous screencast. And what it focused on were particular changes that occur through the aging process and how they impact various body functions, body systems. And so this actually is going into a little bit more detail about those particular changes. So there's a lot of correlation between this screencast and the previous screencast. And so make sure that you're looking at this one because it really focuses probably where I'm going to spend some time with regards to the exam. Now, we know that a number of physical and physiological changes occur during adulthood, and many of these will actually impact dietary intake and the nutrients that our body needs to function normally. The first one that we're going to look at are changes in body composition. Previously, we talked about sarcopenia, which is age-related muscle decline, and there's no getting around that. That happens. In addition to that, it appears that the fast twitch fibers, those fibers that are larger and generate more force, are more susceptible to age-related declines. Now, this is important because when we talk about the loss of muscle mass, we're talking about tissue that's metabolically active. We're also talking about potential like increased risk for fall due to decreased stability and things of that nature. So one of the things that's really critical to do is making sure that you have an active lifestyle. Now, as you lose muscle mass or lean mass declines, you're actually going to see an increase in fat mass. Along with the loss of muscle will be an overall decrease in body water because remember, muscle has a high water composition. Now, the type of training that is recommended to prevent this decline is resistance training. There's plenty of research indicating that resistance training for the older adult is perfectly safe, that there's no consequences associated with it. There's no evidence that it results in any more injuries. So it definitely is recommended to help combat sarcopenia. Now, it's not going to be as rigorous as a younger person, but once again, this is going to be critical. You want to exercise at least 2 days per week. And when you're talking about weights, you want to start with really low weights and generally add and increase the resistance over time. You want to concentrate on the major muscle groups of the body, such as arms, shoulder, chest, abdomen, back, hips, and legs. And also another real important skill to work on is exercises that are going to build grip strength. The standard protocol for an exercise regimen is 10 to 15 repetitions of each exercise. Then you want to perform another set of 10 to 15. Make sure that you're getting adequate rest between sets of exercises. Make sure that you're not locking your joints. So it's always important to have flexible and slightly bent joints. Stretching once you're done with your resistance training workout is really important. If your body starts to hurt or you start to experience pain, you definitely should stop. And once again, making sure that you're breathing through the exercises. That's also really important. You don't want to be holding your breath or performing Valsalva maneuvers because that is actually going to potentially increase blood pressure, and that's not something you want to do. Now, when we look at declines in the skeletal system, this is exaggerated, especially in women after the age of 50 because of menopause. In men, it's slow and steady and begins at middle age. Depending upon the degree of bone loss, this may result in osteoporosis. It is important to realize that this is a disease of men and women. Now, there are a couple of strategies that I like to recommend, and part of this also ties into muscle mass. And how I like to term this is having muscle and bone in your bank. And I use retirement as an example because when you retire, you want to have a nice financial cushion. Because once again, you're going to be spending money, but you're not really working. So you want to have that nice nest egg. The same when we start talking about bone and muscle. There's no getting away from the fact that the levels decline as we get older. So the more you have in the bank per se, the decline will not matter as much because you have high reserves. Now, some strategies specific to counteract osteoporosis: making sure you're getting adequate amounts of nutrients such as calcium, vitamin D, and protein. Avoid smoking and drinking alcohol in excess, and also make sure that the exercise that you are doing is of a resistant nature and weight bearing. There is evidence that high impact is better. So things like jumping, things like that, there is a greater stress on the bone to promote bone growth. Now, cardiovascular system also will be declining as we get older. So a couple things to keep in mind here. As we get older, the heart will pump less efficiently. A lot of this is due to decline in physical activity as we get older. So it really is important that we remain physically active, we don't smoke, and also eat a low-fat diet rich in nutrients and moderate sodium. When we look at the respiratory system, lung efficiency will decline with age. Remember, the processes of ventilation are driven by skeletal muscle. So another thing that we see due to loss of muscle. Other things that we should avoid from are not smoking. Exercise here, we want both cardiovascular and resistance training. And it also is important to have a diet rich in antioxidants. The digestive system, one of the things, a number of the gastric secretions such as intrinsic factor, lactase, and the production of HCl, they all decline. And this may potentially result in impaired absorption of a number of nutrients and potentially result in constipation. The gallbladder and pancreas don't function as well as they did when individuals were younger. You may result in the development of gallstones and a decline in the production of insulin. Dental health may also decline, and this may cause issues with chewing. When we look at the urinary system, deterioration decreases the kidney's ability to excrete urea. It's not uncommon for older adults to be incontinent. And one of the things that really does impact many older adults is this fear about an inability to control bladder. A couple of things. It may cause a restriction of fluids, but it also may have an impact on them not wanting to go out in public as much, potential embarrassment due to the incontinence. So there are some other factors here beyond the physiological decline of urinary system function. As we get older, similar to muscle cells, we lose nerve cells, and this can actually result in a decline in some of our special senses, such as taste and smell. Some people will experience an impairment of neuromuscular coordination, reasoning, and memory. There also is evidence of declining vision and hearing. Now, the immune system. So making sure that you are consuming those nutrients that are especially critical to the immune system. So protein, vitamins, iron, and zinc. That's going to be really important. What may happen is periods of recurring sickness, poor wound healing. Those are examples that the immune system is not working as well as it should. When we look at endocrine system, typically there's a decline in hormone synthesis and also a slowing in the release of these hormones. As far as the reproductive system goes, iron needs will decline in postmenopausal women. Diets rich in vitamin D and calcium help maintain bone loss after menopause. In men, there's a decline in testosterone, and this is due to the decrease in lean body mass. When we look at chronic disease, the risk for many of these increase with age. We've addressed many of these along the way. Examples are obesity, heart disease, osteoporosis, cancer, hypertension, and diabetes. And as indicated, all of these increase with age. Now, there are also a number of medications. As we get older, it's not surprising that many people take medications on a chronic basis to take care of a number of medical situations. Now, some of these medications can have a number of effects. They may impact nutritional status. They may actually depress taste, our ability to smell things. Aspirin actually increases the likelihood of stomach bleeding, so that is going to result in a greater need for iron. Antibiotics will deplete the body of vitamin K. Remember, antibiotics will have an impact on the bacterial colony that we have in our large intestine, and that is where vitamin K is actually produced. Diuretics and laxatives will cause excess excretion of water and minerals. Iron supplements, as we know, can interfere with the absorption of zinc and copper. And also it's important as far as folate supplements, if you're getting too many, they can actually mask a vitamin B12 deficiency. This particular table here basically gives you a list of drugs that are commonly used and also the impact that they have on nutrients. So I'm not going to go into a lot of these. For the most part, you can take a look at these, but most of these are very commonly prescribed medications, and it's important to realize that they're important to account for the medical situation they're taken or prescribed for, but they're also going to have an impact on many of the nutrients that we need. Now, in addition to medical situations, there are a number of psychosocial factors. One thing is a loss of appetite and interest in food. This can be created by a number of things such as depression and apathy. As we get older, many individuals have feelings of social isolation, grief due to the loss of a loved one, and as we're getting older, this is a pretty significant change in lifestyle. Now, people may cope by doing one of two things, over or under eating, and there are a number of risks associated with this. Obesity from overeating. We may be looking at weakness, poor nutrition, and mental confusion as a result of undereating. And then this is only going to create a downward spiral with regards to feelings of isolation and loneliness. Now, there are a number of guidelines that are important that you follow as you get older, and these are eat regularly. Now, smaller, frequent meals are best, and making sure that the foods that you're ingesting are nutrient dense. Try to eat often with friends and relatives. Once again, eating should be a social thing, and it's going to take care of problems associated with isolation. Eat in a positive area that's well lit or sunny. Basically, having the food look attractive, bright colors, things like that. Those are positive things that are going to enhance the dining experience. When possible, take a walk before eating. This exercise will actually stimulate the appetite. You want to make sure that the kitchen and eating areas are also easy to clean up. You want to, as much as you can, use labor-saving equipment and foods. So pre-cut salad mixes, beans, canned fruit, frozen fruit, things like that are all strategies that make the preparation of food a lot easier. It's also trying to keep things exciting. You want to try new foods, try new seasonings. That's a really great way to change the texture and taste of foods. And also trying to prepare foods in different manners. Now, it's also important that you have on stock lots of easy to prepare foods. That way, when you're tired, you're not going to not eat. It's going to take less time to create these types of meals. It's not uncommon that if you have a neighbor, you might want to share cooking responsibilities with them. You want to have dry milk handy, and that's a way to add nutrients to recipes for baked foods, casseroles, meatloaves, things like that. When you have a good sized freezer, if you cook larger amounts, you can divide them into smaller portions for a later date and freeze. When necessary, you want to chop, grind, or blend hard to chew foods. Softer protein-rich foods can be substituted for meat when poor dental health limits normal food intake. Other foods that are helpful are soups, stews, cooked whole grain cereals, oatmeal, and casseroles. If arm or hand movements are limited, you want to cook the food before serving it. Use utensils with deep sides or handles, and also, if necessary, obtain specialized utensils. Now, there's a number of sources out there that you can get. A really good example is Congregate Meal Program, aids in shopping for groceries, and also being able to perform other daily needs related to cleaning and maintaining the household. Buy only what you can use. We do know that smaller sizes are more expensive, but letting food spoil is also expensive. Ask the grocer to break family-sized packages or wrapped meat or fresh vegetables into smaller units. Most grocers would be more than happy to do that for you. Buy several pieces of fruit, not in the same stage of ripeness, so that these fruits can actually be eaten over a period of several days. So some that are ripe and ready to eat right away, and some that will be ready in a couple of days. You may want to consider meal replacement bars or liquid formulas for the occasional snack. Once again, these are things that make it easier to get necessary nutrients in a single serving. And of course, making sure that you're staying physically active. These are all really important strategies that are going to help us in our eating habits as we get older. Now, another important thing to keep in mind is economic factors as we get older. Many individuals, as they get older, they're no longer working. They're basically subsiding on Social Security and a limited income. And that can really make eating and purchasing foods quite a challenge, especially for the older individual. Now we know due to the pandemic, many people are unemployed. We've all seen the huge increase in people waiting in food lines to actually get food, not something that we saw prior to the pandemic. There's also a number of food programs out there. There's the Commodity Foods Program and Supplemental Nutrition Assistance Program, or SNAP. Those can be especially helpful for those with limited income.